Hello friends, today I'm going to tell you about mumps. In this video we will cover Introduction, Symptoms of mumps, Causes of mumps, Diagnosis of mumps, Tests to diagnose mumps, How long does mumps last, Prevention of mumps, Treatment of mumps. So let's get started. What is mumps? Mumps is a contagious disease caused by the mumps virus, which belongs to a group of viruses known as paramyxoviruses. The illness starts with mild symptoms such as headache, fever, and fatigue. But then it typically leads to severe swelling in certain salivary glands, parotitis, that causes puffy cheeks and a tender, swollen jaw. What are the symptoms of mumps? The first mumps symptoms are often mild. Many people have no symptoms and don't know they're infected. Symptoms also don't appear right away. The incubation period, the time between infection and illness, ranges from 7 to 25 days. Mild mumps symptoms may include fever, headache, muscle aches, fatigue, loss of appetite. A few days later, painful swelling of your parotid glands may occur. Your parotid glands are salivary glands located between your ears and jaw. The swelling, known as parotitis, can occur on one or both sides of your face. This classic sign of mumps looks like chipmunk cheeks because your cheeks puff up and your jaw swells. Parotitis occurs in more than 70% of mumps cases. What causes mumps? The mumps virus, which is a type of paramyxovirus, causes mumps. The virus spreads from person to person through direct contact with infected saliva or through respiratory droplets from the infected person's nose, mouth, or throat. The infected person can spread the mumps virus by sneezing, coughing, or talking, sharing objects containing infected saliva, such as toys, cups, and utensils, playing sports, dancing, kissing, or participating in other activities involving close contact with others. How is mumps diagnosed? Your child's healthcare provider will ask questions about your child's symptoms and perform a physical examination. They may be able to diagnose mumps based on their telltale swollen salivary glands. Your child's provider may request specific tests to diagnose the condition. What tests will be done to diagnose mumps? Your child's healthcare provider may request a polymerase chain reaction, PCR, test to diagnose mumps. They'll swab the inside of your child's cheek or throat to collect a sample of their mucus. They'll send the sample to a lab, where a pathologist will examine it and look for the mumps virus. Your child's provider may also request a blood test to help make the diagnosis of mumps or to rule out other conditions and viruses that can cause parotitis. How long does mumps last? Most children recover fully from mumps within a few weeks. Your child can return to school when symptoms have improved and it's been about a week since swelling started. Can mumps be prevented? Mumps is a highly preventable disease because of the effectiveness of the mumps vaccine. Healthcare providers usually give the vaccine for mumps as part of a combination vaccine that protects against measles, mumps, and rubella. Children usually receive 2 doses of the measles mumps rubella, MMR, vaccine as part of the childhood immunization schedule. They receive the first dose between 12 and 15 months of age and a second dose between the ages of 4 and 6. How is mumps treated? There's no specific treatment for mumps. The disease must run its course and usually goes away on its own within a couple of weeks. Mumps treatment focuses on alleviating your child's symptoms to make them as comfortable as possible. The following steps can help manage symptoms. Drink plenty of fluids. Gargle warm salt water. Eat soft, easy-to-chew foods. Avoid acidic foods that make your mouth water. Suck on an ice pop to soothe a sore throat. Place ice or heat packs on swollen glands. Take non-aspirin medications such as acetaminophen and ibuprofen to reduce fever and help with pain. Homeopathic treatment. Belladonna. When the illness comes on quickly with high fever, a hot flushed face, and eyes that are sensitive to light, this remedy may be indicated. Carbo vegetabilis. Mercurius solubilis. Pulsatilla. Aconitum napellus. Apis mellifica. Arsenicum album. Bryonia. Thanks for watching. Doctor Online 24/7. By Dr. Sana Bawani.